only about half of all people that are going on Medicare or eligible at 65 really have to go on Medicare.
Well, hey, Marvin, welcome to the show. How are you?
Hey, I'm doing great, Rafi. Good to be with you today.
Thanks. I'm excited to have you here. I'm excited to talk about everything Medicare and Medigap and supplement and all that. But before we do any of that, why don't you tell us a little bit about yourself, about what you do, and kind of what brought you to what you're doing now with Medicare policies?
Sure. Well, my son and I started this business back in 2009. We were in excuse me, we were in the insurance business, and we began to see a real void and found a niche and making sure that people that were ready to go on Medicare really understood what they were doing. So many times people are confused by Medicare, a lot of rules, requirements. And so we began to establish really an educational platform. Used to do live events all over the country, actually. And so found a niche and realized that that's what the consumer needed. The consumer did need some agent just pushing a product on them, trying to get them to make a quick decision. But so we backed up and said, okay, let's teach them about Medicare first. Everyone's got to buy insurance, but do they really understand what they're getting? Because there are some options, and some are better than others, and there's certainly not a one-size-fit-all type product. So we put together an educational platform, and honestly, from there, just blossomed. Did a lot of live workshops, then COVID hit, and we had to go online.
Went virtual, yeah.
Exactly right. So now millions of people, of course, we get to educate. But that's how we got started. Now that's been 15 years, and things are going well.
That's awesome. Cool deal. Yeah, and I think from a standpoint, just as somebody that owns a clinic and sees patients coming in all the time, it is amazing to me how many people are maybe like 3 or 4 years into a Medicare like Advantage policy, and they still think they have like the red, white, and blue card and all of that. So we're going to dive way into that, get into the weeds.
Sure.
So I guess just the baseline then, why do people need to learn about Medicare?
Okay.
Like let's start
Yeah.
there and kind of
Yeah,
dive into the different
let's
plans.
do first off, the majority of people that are on Medicare are on it because they have become eligible because of
Yeah.
age,
Yeah.
which is 65. Now there are actually about 15% of the population that's on Medicare because of Social Security disability, because that group actually gets Medicare on the 25th month of having received disability payments. But 85% of all people that are on Medicare today are aging in at 65.
They're
And
folks
really,
that retired and they kind of just they got a letter in the mail that said you're eligible for Medicare now, right?
yeah, well, that is exactly right. So they have to make a decision at 65. But what's interesting, though, is that only about half of all people that are going on Medicare or eligible at 65 really have to go on Medicare. About half will, half don't. And the reason is because Medicare is very happy for people that are continuing to work to stay on their work plan. Especially the work plan is very attractive, good premiums, attractive coverage, good network, and all that. So there are half people that do have to go on Medicare, but the other half don't. And so we educate people about that. Stay on a group plan if it's a good one, if it's the premium is attractive, and especially if you have other family members on your group plan. Those that are younger that don't have a good insurance option, could be a spouse, could be children covered at age 26. So really, that's where we begin. We remind people go on Medicare at the right time. And so if you have a good group plan, don't go on Medicare. It's fine. Now, the key to that, though, is that those group plans do have to have 20 or more employees on the payroll to stay on it. If there's 19 or less employees, people do have to go on Medicare. They have to put Medicare in the first payer position, because small group plans only pay second to Medicare. And so again, people have to decide, is it right to go on? And so for the group that has to go on Medicare, they're the ones at 65. And it's basically really simple because those people are no longer working. They could be on COBRA insurance. They could be on what's called TRICARE, which is military insurance. They could be on an ACA plan. And so that group has to go on. And so the first decision, go on Medicare at the right time. And then from there, what we do is we walk them through that process. Because people that are on Social Security, they're automatically enrolled into Medicare. They're going to get a red, white, and blue card. But the other group that's not on Social Security, they have to enroll, and there's timelines for that enrollment. And so we teach them about that to make sure that they're coming in into that A and B system at the right time and following the right process.
Yeah. Explain a little bit about that A and B system, because I know we've had some people that maybe have enrolled into like A but not B, and they thought they were getting it all. So when you enroll in Medicare, you're not automatically enrolled, number one, and there are different coverage types, right? Like you need to enroll in each different plan.
Exactly right. So the only people that are auto-enrolled are those that are receiving Social Security, and they're enrolled into A and B. The other group has to make a decision. And so I referenced people that are covered by large group plans. That just means 20 or more people. They actually don't have to do anything with Medicare. They don't have to do A, they don't have to do B. And why that matters is because if someone is still working, they could be covered by a high deductible health plan that has attached to it a health savings account.
Yeah.
And so we tell them do nothing, because if they enroll into A only, they can no longer contribute to their health savings account, which in my opinion, they really hurt themselves, because they're tax advantaged ways for people to be able to accumulate money that's tax deferred, tax deductible towards future medical expenses. So we like HSAs.
Yeah.
So people that are still working, we tell them do nothing with Medicare. You won't be penalized, and pick up Medicare at a later date. Now, those that are continue to work and don't have an HSA, then we like them to do A only. It's good to get in that system. But what they usually are not aware of is that if they're covered by a large employer plan and they enroll into A only, what happens is Medicare still takes the second payer position. And Medicare A, hospital in the second payer position, will not pay deductibles, will not pay copays, but they will pay coinsurance. And they may cover something that the group plan did not cover. So we encourage people to take A only if you keep working, unless you have an HSA. So those that have HSAs, those that are listening, I wouldn't do anything with Medicare and you won't be penalized. Now they'll hear that you have to take A, but you really do not have to. All right. And so, so when it comes to the A and B system, the way to really understand it is A is pretty much everything inpatient, B
Yeah.
pretty much everything outpatient, plus all doctor services. And so when people are fully on Medicare, they're covered under A and B. And so regardless of someone getting a supplemental plan or an advantage plan, they have to be enrolled in A and B to have either one of those types of coverages. And so my point is that we come into Medicare at the right time. For those people that are starting at 65, we call that the initial enrollment period. And
Okay.
it's only a 7-month window. That's it. And that
Oh, holy
7-month
smokes.
window. Yeah, 3
Okay.
months before they turn 65, the month they turn 65, and then 3 months after. So they have to come into Medicare during that 7-month window, or they're creating problems for themselves down the road. Now, people that don't have to start Medicare at 65, meaning they're covered by a group plan, and might I add, it's not just their group plan, it could be their spouses. Either way is fine. They will come into Medicare using a different enrollment period, and that's called a special enrollment period. And that's for people starting at 66 or 67 or sometime in the future. And that's a little bit of a different process. There's some extra paperwork involved. And so we as a firm actually help them through that process to make sure it's done correctly. And so my point is, when we go on Medicare and we settle that A and B account, then people have to look at their insurance options. And there's
Yeah.
really three options. One is to do A and B only. And sadly, 10% of the population actually will do that. And that is a bad decision. The reason is because A and B only leaves people with this tremendous amount of financial liability. They're responsible for all the gaps that exist in Medicare. And so that A and B option is not wise for that reason. In fact, let me share this with you, Rafi. There's an interesting stat, and it is this: that right now in America there's $220 billion of medical debt. 220 billion unpaid
Wow.
hospital bills, unpaid doctor bills, unpaid physical therapy bills. They're just a lot of debt. And the second largest holder of that debt today are Medicare eligible people.
Oh, wow.
Amazing. Yeah.
Yeah.
So, I mean, multi-millions of dollars owed by that group of people. And in large part, it's those people that chose to do A and B only. And then they had some kind of a serious illness, and they're responsible for all these gaps that Medicare didn't cover. And I do want our audience to know this, that Medicare doesn't cover anything 100% except for preventive services. That's it.
Yeah.
Preventive services, screenings, those kinds of things Medicare will cover. But beyond that, when we get any healthcare service in Medicare, there's always a balance to the bill. You're going to be responsible for that. And so if a person has that A and B only, well, they're responsible for that entirely. So hence comes the reason for Medigap policies or Med Sup policies.
Yeah. Because that kind of takes you to the next level. Like there's A and B only. Boom. We've already discussed that.
Right?
It gets you minimal coverage, but there's going to be some financial obligations on your end. A lot of times, what, 20, 30% in some cases, or
Exactly right. You're exactly right. So the majority of people see how really unwise of a choice that is, and they will decide that they want to get a supplemental plan, which is basically anytime you get insurance, we're just taking liability that we have and
yeah.
we're transferring it to an insurance company. And as we transfer liability, we have to pay a premium for that. So we call the liability the gaps in Medicare. And I won't get into the weeds on that other than to say this. There are 3 gaps on the A of Medicare, and there's 3 gaps on the B of Medicare. So I'm responsible for all of those gaps. So what people used to do, when I say used to do, the system changes over time. But prior to January 1, 2020, people could actually transfer all the liability to an insurance company, all of it, all the gaps, all 6 gaps. And that was actually a Medigap or Med Sup Plan F. And there are a lot of people who still have that F plan.
Yeah. They're grandfathered in.
That's right. They were grandfathered in, full coverage plan. But anyone born after January 1st, 1955, or starting Medicare after January 1, 2020, the most comprehensive plan is a G plan. And that G plan will actually cover 5 of the 6 gaps. So almost full coverage, but not quite. So that is actually the most popular supplemental plan today. 70% of all people that are buying SUPs are getting the G
Yeah.
plan. And with that plan, they would then be responsible for only 1 gap, and that's called the Medicare B deductible. So it's an annual deductible. This year, 2024, it's $240,
Yeah.
and it's once a year. That's it. So when someone has that G plan, it's almost full coverage. They'll pay a premium. And again, we're a nationwide broker, so we write all over. But the average premium on a G plan right now is going to be anywhere between $115 to maybe $130, that range. So still very affordable. But again,
And then the out-of-pocket cost is so small. I mean, $240 for a deductible
absolutely.
is tiny.
That's right. They should never see anything. And here's the key to that. Anytime Medicare pays, we're seeing a Medicare provider and Medicare covers the service, then the only out-of-pocket expense would be just that B deductible, because Medicare doesn't cover everything. Probably the greatest example of something that Medicare won't cover would be chiropractic care. Chiropractors, I think, are valuable. I have one and I benefited greatly, but Medicare says the only thing they'll cover at a chiropractic visit would be adjustment of the spine. Beyond that, nothing. No X-rays, no traction therapy, those kinds of things. So if Medicare doesn't pay, the supplemental plan will not pay either.
Yeah.
That's right. And so that's what we want people to understand. Supplemental plans follow Medicare. As long as Medicare pays, your supplemental plan will pay based upon, the one that you bought. Okay.
Yeah. And I think it's important then to kind of delineate, because we've kind of went into the supplemental plan, but there are advantage plans or replacement plans and supplemental plans. And we're talking supplements, which means if Medicare covers it, they say it's good, then the supplement will basically fill in the deductibles or fill in the co-insurance or whatever.
Got it. You're exactly right. So as long as they're seeing a Medicare provider and a Medicare covered service, that's exactly how it works. And so, so as we talk about Advantage plans, of course, they came into the market in 2003, and it took a while for them to get ramped up, but they're very popular today.
Yeah.
They say a little over 50% of all people today going on Medicare are covered by some type of an Advantage plan. And I will tell you, as I share some things with you about them, Advantage plans can be a good fit for people. There is a place for them. But one of the biggest issues today is that they're marketed without really giving a lot of good details about how that plan is going to work. And the reason for that is because the insurance companies are making, billions of dollars of profit off of them. Agents, we are actually paid a higher commission with Advantage plans. We get longer residual commissions off of Advantage plans. So the point is they're pushed because it's favorable for the insurance industry, but is it really favorable for the patient, the person enrolling into that? And that's where I have my reservations.
Yeah.
This is long enough to see some of the disadvantages of Advantage plans, and people they don't find out about these disadvantages until, frankly, it's too late, and that's really sad.
Yeah, a lot of times people think they're getting, this big whiz bang coverage or something like that, and then they go to a certain doctor and they're told, oh, well, you need authorization for this, or this actually isn't covered, or there's an extra cost for this, and
Yeah.
I guess let's just kind of define like what is a Medicare Advantage plan, and then we'll kind of talk about well,
Sure.
why might you want to look at that in this situation versus not, and kind of advantages, pros. So, what is a
Right.
Medicare Advantage plan?
Sure. They're called a couple things. You mentioned it, replacement plans. They're also given the letter C. And so Advantage plans are a private health insurance company that is actually replacing the A and B system for you. You're now falling under the guidelines and really the direction and rules of a private health insurance
Yeah,
company. And so what happens is that private health insurance company is now responsible for you because Medicare is no longer going to cover any bill. Medicare takes a flat fee amount and pays that Advantage company. And that's right now around $1,000 a month or so. When people have chronic illnesses, they actually get a little bit more money. But the point is, they get a flat fee, and therefore they take the responsibility. So what people often don't realize is now you're under the direction of that. That's why they call
yeah,
those coordinated care plans. And so with the Advantage plan, they're able to actually add some rules to them that can make it difficult for people. And the biggest rule, you mentioned it, is the whole pre-authorization issue. Now, the government is trying to, because they've had so many complaints about pre-authorizations, millions of complaints, they are trying to do something about that. There's some new legislation out that was passed. The final rule in 2024. I'm skeptical about that just because I think that the intentions are good. I think the government would like to see some changes, but it is such a big system. And they have fed that system so long with very little accountability to the insurance companies. There's been a lot of abuse. And so I don't think we're going to see that train turn around very quickly. But pre-authorization is a service where it's expensive. It's a CAT scan, an MRI, a PET scan, extended skilled nursing stay. It could be a knee replacement, a hip replacement. All those things have to be pre-approved by the insurance company. The stat on it is about 70% of the services that people need on Advantage plans are going to have to be pre-approved by the insurance company. Okay, so
man,
doctor
yeah,
doesn't have final say so. Doctor basically is recommending, and then the insurance company has to agree and approve before there's going to be payment on that. And sometimes they do that immediately, and sometimes they delay that. Sometimes they flat deny that. And I've
yeah.
had it happen in our own practice. People need a knee replacement, and Advantage Plan says, no, you need therapy for 9 months. And then we'll revisit the possibility of the knee replacement. Had a lady not long ago that needed a full hip replacement. Advantage Plan said, no, you don't. You need a rod, and that's all we're paying for. And
Oh
so
wow,
those kinds of things happen, and people don't realize that until they get in it, because normally, people are 65 healthy, and they look at the, little perks that the Advantage Plan offers that make it, real attractive. And then they have a health issue. They have cancer or some heart issue or, need a surgery. And then they begin to realize, oh, so this is how this system works.
yeah. I think the big one there too is like people think they get into these replacement plans and they get sold on, oh, it's got these extra benefits, and in their mind they're thinking, well, it's Medicare, it's going to cover what Medicare covers. But like you said, if it's a Blue Cross plan, you fall under what Blue Cross decides. If it's a Humana plan, Humana is making the decisions about what they're going to approve and what they're not going to approve.
Exactly right.
um so I guess in what situations, given that understanding, like at what situation does a person say, oh, a Medicare Advantage plan or replacement plan might be right for me, instead of going with the traditional Medicare with like a supplement or something?
Okay. Okay. I think the primary reason would just be financially. If someone cannot afford a monthly premium on a supplemental plan, meaning their budget is so tight
Yeah,
that they just can't do it, then we tell people don't try to do it because you're not going to keep your supplemental plan. You can't afford it. You'll just cancel it in 2 months or a year or whatever. So
yeah, and
I
then you'll
think
be on the hook
that's
for a huge bill
that's
later.
yeah. Just go ahead and realize an Advantage would be a good situation. I really encourage people, if they can, if they have to be on a Advantage plan, I like a PPO plan because we have a much broader
Yeah,
network. Now, what happens though, Rafi, is that the insurance companies they will really beef up an HMO network plan because they have more control.
yeah,
And so the HMO plans have lower copays, they have lower max out of pockets, they will have richer perks, benefits. And so they make those very attractive. So the PPOs are not as attractive financially, but at least then we have a much broader network. Those
yeah,
HMOs can be very limited, and unless it's an emergency, you cannot go out of your network on an HMO plan. You have to stay confined
See
within that
them.
network.
Yeah.
And
Well, and
that
I
can
think,
be a real
can you
problem.
back up and like just very broad brush, what is a PPO? What is an HMO? Because there's some people that get confused between the two.
Oh, sure. Yeah. Well, of course, they're acronyms. HMO just simply stands for Health Maintenance Organization. PPO is a preferred provider organization. And what happens when all the insurance companies are going to offer both. So if
Yes. Yeah.
they are. And so what they do is they put together a contract. And so they'll say to a provider, a hospital, a doctor, someone that does what you do, they'll say, okay, here's what we will pay when you see our patient in this particular network. And so the PPO contract pays the provider more money. And so that means there are more providers willing to be in that network.
Yeah.
HMO pays less. Now, the philosophy behind all this is that the insurance company says to providers on the HMO, say, well, you don't get as much money, but we'll send you more volume.
Yeah.
And some providers say, I don't need more volume, I need more cash. I want more money for these services. And so they meaning providers typically are a little bit more willing to be in the PPO because they're going to get the reimbursements are higher on those. So that's the difference. It's just simply it's a managed care plan, and the issue with networks is they're fluid. You could have a doctor in the network this year and they're
Yeah.
out.
And then they leave. Yeah.
Hospital groups, a whole hospital group pulling out of Advantage plans because they're tired of slow pay. They're tired of the pre-authorization process. They're tired of they think a service is covered, and then the insurance company says no, this was not covered, and so the billing can be a real problem with Advantage plans. So people have to realize when you get in that Advantage plan, you will always be in some type of a network, HMO or PPO.
Yeah. As opposed to Medicare, which is very, very broad. Most people, with some exceptions, most people take Medicare.
Absolutely, absolutely, yeah. And in fact, 100% of hospitals do, and they say upwards to almost 99% of all doctors
Yeah.
do,
Yeah.
providers. And so you almost have an unlimited network if we stay in the A and B system and get a supplemental plan. Because if the provider takes A and B, they have to take your supplemental plan. They can't say, oh, we don't take that. They have to, because it's nothing more than the secondary payer. That's all. They're not making any healthcare decisions at all. So point being is that with the supplemental plan, you never are going to have to deal with these network issues. And I'll tell you another great example. Some of these Advantage plans are regional plans or local plans. And when people travel, a few states away, I've had a lady from the Midwest goes to Hawaii, couldn't hardly get any proper care in Hawaii. She was on Advantage plan,
Yeah.
very frustrated by that. But when you are in original Medicare in the supplemental plan, you pull out that red, white, and blue card and that
And
supplemental
you're good to
card.
go.
It doesn't matter. I don't care if you're in, Las Vegas or Miami. It's going to be all the same coverage for sure. And so the ease of the care is just much, much better. But again, you asked me, why would people do it? They would do it because they can't afford that monthly premium. And then if people are just convinced that, hey, I'm healthy, I'm going to stay healthy, I say, okay, if you got a crystal ball and you really are confident for the rest of your life you're going to be healthy, then take the Advantage plan. Okay, you'll save some monthly premium. But if you get sick, you almost always will spend more money on your Advantage plan than you will on your supplemental plan, because Advantage plans set what is called an annual max out of pocket.
Yeah.
HMOs right now on average are between about 3 to maybe 4 or 5,000 a year. PPOs are going to be usually 4 to 7,000 a year. Go out of network could be 10 or 12,000 a year. So you have an illness, you'll spend more money for sure on your Advantage plan than you would your premium for that supplemental plan. So
Yeah.
people say, I'm willing to take the risk. Let's find the best Advantage plan. I'd also like to share with you one thing that I think is very confusing to people. Every year, Medicare has an open enrollment season, and that season is October 15th through December 7th. And
Yes.
because there's so much advertising, a lot of activity, people think that once they're in the Medicare system, they can just switch plans as though there's no rules. Hey, I'll take the Advantage while I'm healthy, and then 5 years later, I get cancer, I'll switch back to original Medicare. That cannot happen. Okay. People just can't switch back and forth at will. They have to follow certain rules. And one of the biggest negatives of the Advantage plan is if someone's on Advantage plan, and let's say they stay on that for a year, 2 or 3, 4, 5 years, and they would like to get back to A and B and get that supplemental plan, they cannot make that move without medically qualifying. we have to actually ask them 30 health questions. We have
Oh,
to
wow.
check their meds now in the last 2 years. We have to get a statement from their doctor, and that information, medical information, is given to the insurance company, and now they're going to go through underwriting. And that insurance company has every right to say yay or nay. It's totally at their discretion. And so people don't realize that. And so if they have, Robbie, even AFib, one incident AFib, rheumatoid arthritis, spinal stenosis, insulin-dependent diabetic that takes a lot of insulin or has any diabetic complications, they will never switch the rest of their life. And now they're in that system. And agents don't talk about it. Why? Because
Yeah.
agents are looking for that lifetime residual.
Yeah. So
So
they can never switch back into A and B, but can they switch to like another Advantage plan?
no, they can no. Oh, yeah, they can do that. Yeah, they can't switch to A and B with a sub without underwriting, but you're right. They can switch among Advantage plans. So if they see one that's more attractive during the open
So
enrollment
it's really
season,
like you said, it's a system. Like once they're in that system, they
they're
develop something, they're kind of stuck in that system.
That's right. They will not come out of that system for sure. And it doesn't mean that they're, like this stuck with this terrible, terrible insurance all their whole life, but they are stuck with networks. They are
Yeah.
stuck with pre-authorizations. And so those are going to have an impact for, forever. Hey, I had a lady write me from San Francisco, California. And she found us on YouTube and was watching some videos. And anyway, so she wrote and it said her husband, 74 years old, was prematurely discharged from a skilled nursing facility. And she said he passed away. Now, again, I'm not blaming the Advantage plan for him passed away,
Yeah.
but the point is, she said that had an impact on his health. And so that's what happens. And people have to realize when you enroll in that Advantage plan, that insurance company truly has the final say so. And a lot of decisions, and I know you know this, are made today with input from AI algorithms that are deciding, hey, how long should you be in that skilled nursing facility? Well, the AI says 19 days or 17 days. Well, that's shared with the providers, and off the people go instead of just looking, at them, physically. Are they really ready to go home? Can they really be taken care of at home? And so those kinds of things happen. And now we have people becoming statistics instead of really getting the healthcare that they need.
Yeah. Awesome. Wow. I mean, that's not awesome, but thank you so much for taking the time to kind of lay this out and explain it all. If people want, and I'm sure people are going to want to know more because this is only scratching the surface, where can they go? You mentioned YouTube, like I'm sure you have a website where people can go and find out more information just about Advantage versus supplement and all of those things that we've discussed, and I'm sure in much more detail. Where can people go and learn more?
Sure, sure. Well, our main website for a company, it's called MedicareSchool.com.
Okay.
And that's because that's how we really believe education needs to start. You start there. Don't make decisions until you understand what you're doing. So MedicareSchool.com, and I've got a kind of a long form workshop there. It's about an hour and what we call just a essentials workshop that's about 20 minutes. But that's a good foundation. And then we do have a YouTube channel, MedicareSchool.com. And Rafi, I have hundreds, hundreds of videos. I try to do 2 a week to make sure that we're up to date on things, so they can go there and probably get more information than ever care to. And we tell people, listen, you don't have to become a Medicare expert to make good Medicare decisions, but you do need to have a good basic knowledge
Yeah.
of your options. And so that really is the purpose of that. And so they could do that. We also, every other week, I do a live stream event, either through our Facebook group or through YouTube. But it's a call in, and it really, not call in, that's not, they type in their questions.
Yeah.
And my son and I, we actually, in our company, we have 70 employees. And my son-in-law is with us, my son, and I have actually 2 sons that are in the business. And so we take these questions and we answer them for people, and they can type a question in, and they can tell us about their situation, and then we can give them some direction. And those are very enjoyable. We have lots
Cool
of
deal.
people, I think, benefit from that. So
Yeah.
that's where you can reach us, and we'd be glad. I do want to share this if you don't mind.
Sure.
We are independent brokers. When people do business in insurance, either you do it with a captive agent, which means they work for one company,
Yeah.
or a broker, and that's us. And I know you would know this. We're independent on purpose, because one size doesn't fit all. We're not bound to say, hey, United Healthcare is best, or Aetna is best, or whoever's best. It's not about that. It's really about, what are you looking for? What are your needs? What's your situation? Then let's find that product that's the best fit for you. And what we really, really care about, especially with supplemental plans, is going with a carrier that is proven to be stable. We look at initial rates, that's the first year rate, but everything goes up.
Yeah,
Medical
exactly.
inflation is a reality, so things are going to go up. But we want to make sure that people understand the importance of, let's look at the long haul. How are these companies, how have they performed in the last 3, 5, 10 years? Because history will repeat itself more than likely. And so we want to make sure that when we select a company, we're confident that that's a good choice. And here's why. Because in the majority of states, in order to even get off a supplemental plan and go to a different supplemental plan, people have to medically qualify to make that move. So let we make a decision initially with confidence, knowing we've gone with a carrier that's proven to be rate stable. And they're out there. They really are. There's some that kind of fluctuate more than I would be comfortable with, and I avoid those, but others that are very stable. And I think, yeah, we have people that have been with the carrier for, I mean, really their whole life.
Yeah.
And so that's what we're looking for. So the point is, we'd be delighted to help people with that process. I will add that any agent, there's no cost for our services or any agent, because the insurance company has to pay the agent. Whether it's a captive or an independent broker, the price is all the same, and we're paid by the insurance company, not by our
Yeah.
clients, which is wonderful. Okay.
Yeah.
And so, if you don't mind me just mention one more thing, and that is
Sure.
that when people are confused about enrolling into Medicare, just getting into the system, we actually do that for people. We help them set up all that. They're called a myssa.gov account, and we help them enroll into A and B, and we'll do that for our clients. And it's just another service we provide. Again, no cost at all, because we just want to make sure that is right first, and then we look at the insurance
Yeah.
products.
Make sure that's squared away, and then you worry about all the fancy stuff.
Exactly right. Yeah.
Awesome.
And
Well,
hey,
Marvin, thanks so much for taking the time. We'll link to everything in the show notes, and have a good one, sir.
okay, hey, appreciate it. Thanks. See ya.